Today we have Dr. Marie Matty, who is a physician who practices in Paulsbo, a neighbor of ours on Bainbridge Island, who has joined us in the past, and we're grateful to have her return now because the story around COVID continues to evolve, and I appreciate her sharing what her expertise is and giving us a little heads up on where we stand. I know that there's a lot of talk about vaccines, and we're starting to see some of our healthcare professionals start to get them. So I thought maybe I'd welcome you, Dr. Matty, and start out with how is that going? How are the vaccinations going at this point in our state?
Great. Well, thank you. Hi, everybody. Good morning and Happy New Year. We're turning the corner on 2020, so that's exciting. And the vaccine is certainly some of the best news that's happened in the last month. You know, I can start just with a little bit of basic background, which is, as you know, I'm sure most of you know, there are 2 different vaccines that have been approved for use in the United States right now, with the third one seeking emergency approval. And the 2 that have been approved are kind of a new technology that has been in the works for years. It just hasn't been used for vaccination yet. It's called an mRNA vaccine. So I can tell you a little bit more about that if you're curious. The third one, which is published by, or is coming out with AstraZeneca, which was made in England with the University of Oxford. It's more of a traditional type vaccine, which is a live, attenuated kind of damaged virus, the way we always have done vaccinations in the past. So it's kind of old school kind of technology. So that one has been approved in the UK, but not yet in the United States, but seeking approval, and they're waiting for some more human studies to be done in the US at this point. The great news is the 2 that we have an incredible rate of effectiveness of 95% after the second dose. There's data all over the place as far as how much protection there is after the first dose. So we're still kind of getting that defined and, you know, a little bit more clearly defined, because they were thinking they wanted to recommend a 2-dose series anyway. So, but we'll find out more about that. So right now, we're getting more and more of the vaccine rolled out. The hospitals have quite a bit of vaccine. So whether that's, you know, the hospitals in Seattle, the big ones, Swedish, Providence, you know, Virginia Mason, CHI, so, you know, the Franciscans, and they are prioritizing giving it to the healthcare providers that work in the hospitals or that have privileges at the hospitals. And so they, you know, I got my vaccine. I got the Pfizer vaccine almost 10 days ago now. And, you know, I'm not I have privileges at the hospital, but I'm not one of those main hospital physicians. So they went through and got all their, you know, big people that are working in the ICUs, and they did that first. And then we were able to get ours done. And now they're really reaching out and saying, any healthcare providers in the community, we need to get them done so we can move on to the next phase.
So that includes emergency workers as well. I think. Yeah. I know that the Peninsula Healthcare people were offering vaccines, I think, to firefighters and paramedics and.
Yep, both the Bainbridge Island Fire Department and the North Kitsap, the Paulsbo, anybody that would want a vaccine there has been able to get one. So so right now 1A is first responders, healthcare providers, and seniors that live in assisted living facilities, as well as the staff of the assisted living facilities. So I would say at this point, you know, we're doing a pretty good job of getting those people immunized. The hard part is having enough places to provide the immunization. So
so I just want to back up there. 1A also included assisted living and nursing home, either residents or patients or whatever, depending on the.
Yeah, exactly. Senior residential treatments of either skilled nursing, rehab facilities, you know, assisted living, all of the above.
That's great news. I didn't realize that was happening. So that's great.
The hard part is a lot of those organizations made agreements with some of the bigger pharmacies like Walgreens to provide the vaccines. And there's just been a little bit of a hang up. I think it's just an administrative issue. That's what you're probably hearing in the news too, is it's just really hard to roll these vaccines out. So Bainbridge Island Community Pharmacy on the 2nd or 23rd, I don't know, I think it was the 22nd, received notification they were going to get their first batch of vaccines, and they received 300 doses. And we're told they had through Saturday, which included the Christmas holiday, to administer it or hand it, provide it, give it back to them so they could provide it for somebody else or another community where they could fulfill the 1A requirement. So they contacted the Bainbridge Island Medical Reserve Corps and myself, Dr. Chimey, who you guys have spoken with as well, worked with them, and we administered all 300 doses in our community to dental offices, healthcare providers, caregivers, some of the staff at the senior living facilities that are on the island that didn't want to wait for Walgreens. They came over. We weren't able to administer it in the facilities because of just that agreement with Walgreens and just the issues that would involve with us going in there.
So I had a conversation with Mark and Casey at Community Pharmacy, and they gave me a link. They have a Survey Monkey for people who think that they might qualify in 1A who might have been overlooked. And so I put that link in the chat. So, and I'll put it in the email following this. So if you know somebody who thinks they should have been, and probably not in an assisted living home where there might have been one of these arrangements, but somebody who might have been overlooked, this is an access point for you that you might find useful.
Yeah, certainly. And I know they're getting another batch of vaccines coming in next week, I believe. So they're also reaching out saying to everybody, anybody that fulfills those criteria of 1A, let us know. We'll get you on the schedule. And now that we've done it a few days, it can be really fast, really efficient. They've got a great system. It was probably one of the most positive experiences we've had with all the different kinds of involvement we've had with COVID, is just moving forward with that.
Now, if I want to know what a 1A, what that list looks like, is that posted somewhere?
Yeah, CDC. So if you go to the CDC's website, because this is a federal guidelines put forth by the CDC, so not state dependent, as we've seen so many of the other things related to COVID be managed. That said, I do see that different states are managing their 1A, 1B quite differently. Here in our community, we're trying to, follow those guidelines pretty, true to the letter. So, yeah, so you can go to the cdc.gov, look at their COVID, see how they delineate who gets rolled out. 1B will be the next one, and that right now is said to be seniors above the age of 75, or 70, excuse me. I believe it was 70 or 75. I haven't looked. They were going between the two, but I think it might be 75 actually. Seniors above 75 and or younger with more than one comorbid condition that places them at increased risk of severe disease from COVID-19. So that's going to be the next, and I don't think they have a real time frame. Everybody wants to know, like, when will we transition to 1B? And I think that is yet to be determined. Certainly by February. I'd like to see it even in the next week or two, to be honest, and start getting those, the seniors in our community fully vaccinated. But I don't know. They said for sure by February, but hopefully sooner.
Will Community Pharmacy have it then?
Which pharmacy?
Community Pharmacy on Winslow.
Oh, yeah. So they're getting another round. I think they're going to continue to do it. The big issue with right now in the entire country is we have the vaccine is available. It's been shipped out, but it's finding enough people to administer it. The bottleneck is in the administration of the vaccine. So Bainbridge Community Pharmacy, they've received it. They've administered, their doses. Now they're waiting for another shipment so that they can continue to do that. We at Pacifica have applied for the authorization to do it. We've been told we can, and that we can receive shipment next week as well. But the way that the community pharmacy found out is they found out on Tuesday, I believe, that they were getting 300 doses, received it that afternoon, and we were dosing people, we were doing it. So let's say Christmas Eve, we started doing it Wednesday, Thursday, and then Friday was off, and then Saturday again. So it's kind of a quick turn, and getting it to the people that qualify is kind of the difficult challenge right now. So as soon as they open that up, I think once they realize that these assisted living facilities have this other batch coming from the bigger pharmacies, I'm hopeful that we'll be able to transition into getting more seniors, qualified to come in and get it.
Okay. And if anybody else has a question, they can either write it in the chat or they can open up their microphone and ask away. So it sounds like there are some you were talking a little bit about some challenges about exactly how, when we start to immunize the larger population, that might be administered. Is it going to be like the flu vaccine where we might check with our health clinic or pharmacies the same way?
Yep, it's going to be exactly the same way. And because of it being, a new virus, we need to immunize as many people as we can. And so the Department of Health, the Kitsap Department of Health, has actually asked any medical clinic, any provider that has any ability to administer this to go through the process to be allowed to do it, because they realize it's going to just take an army of providers to get this out to the community. Just because if you go to your pharmacy, there's a time frame. They can do it really quick and efficiently. But still, we need to be getting, they said 2,000 patients in Kitsap County a day to have 50% by July. So that's a lot of people getting vaccinated on a day-to-day basis in our county to even get to that 50% rule or 50% goal by July. So, and right now we're a little bit slow in that. And I think that's just administrative buildup, people getting, all their information into the Department of Health to be able to get the vaccine delivered to them and start administering it.
I have a question. How will we know when for example, in this case, the community pharmacy would have the vaccine for a person such as myself over 80?
Oh, I think that it will be in the news. I think there'll be social media posts. As soon as you hear that we are transitioning to that statewide, I think everybody will know. The word of mouth, it'll spread. I think the news will notify. They will post it at the community pharmacy. It'll be on their website. So I think there's going to be a huge push to get that information out. And then you just need the staffing to administer that in addition to all the other work you're doing. So I'm optimistic. So I
have a question.
Oh, go ahead. Yeah.
Go ahead,
I
Madeline.
have a question about a second dose. Is there a way that you'd be notified when a second dose? I mean, how are they allowing all, as it comes in and you get rid of it, then sooner or later they're going to need more for the people who've already had the first dose to do the second dose. And how does that work?
Yeah, that's a great question.
Exactly.
Yeah, and there was, a debate about, do we save vaccine? How do we decide how to do that to make sure the people that get the first dose can also get the second dose? And the decision was made not to hold the vaccine because we know there is protection offered for after one dose. So there isn't vaccine being held, but again, at this point, it's not an availability of vaccine that's the bottleneck, it's that administration of it. So we should be able to we shouldn't have a problem with it. What they're doing is when you go get your vaccine, the first thing that happens is they have you fill out some paperwork just describing if you've ever had any allergies to vaccines, just what your general health is, wanting to know if you've had a prior vaccine in the last 2 weeks, and then basically consent to receive the vaccine, of course. And on there, you provide, for seniors, you'll provide your Medicare number or any other supplemental insurance you have, and you put your phone number down, and they're using that phone number to call people back in at the time when they get that second dose. So you can see there's a lot of administrative work in all of this, which is what's taking a lot of time up. But that's the plan right now. If you get it from your healthcare provider, what I suspect will happen, what we're planning to do at our clinic is when people come in, we get their first dose, we schedule them when they leave for their second dose. And what we're trying to do is we're most likely going to get this, there's two different ones. The Moderna can be stored in a refrigerator for 30 days. And so we're trying to get enough that we can keep that second dose for people as well, just not knowing how that supply is going to end up happening. And I think all of this is going to be really dependent on where you decide to get your vaccine, how they're going to manage it. But everybody is in it to get both doses. And that time frame, again, on a side note, is where there's a 3-week time between the doses for the Pfizer and a 4-week. That's just kind of a loosey-goosey. That's kind of like a minimum. But if it gets extended out, it's not going to affect the effectiveness whatsoever. That's just like, how quickly can we get that second dose? But if there's a little bit of a delay, it's totally fine.
Good news. So Mike had his hand raised. He figured out there's a raise hand button. I like that.
Oh.
You know how to unmute now, Mike? And we can ask your question. There's to the left of the, there you go.
Hi. Well, thank you so much for being here today. I just have a quick question. I was looking on the CDC website just now on the levels, and it was clear, sort of, because it says you should. It'd be nice if you did. It's because I guess they recognize not everybody's going to follow their guidelines. I just have a question. My wife is 69 and has MS. But when I look at the guidelines, 1A, 1B, 1C, 1B says 75 or older, but it doesn't say anything about, autoimmune. I forget what the word
And
is.
the comorbidities.
Yeah.
That should fall into 1B as well. I've seen that as part of their recommendation. So people under that age with a chronic health condition, of which that encompasses many things, certainly MS and autoimmune problems, but she'll be in that 1B category as well. And like you said, it's up to individuals how they interpret those CTC guidelines, like how strict you are. But we saw, and I don't know the details, I just saw the headline of one clinic that is getting in trouble for administering it outside of those guidelines. So people want to make sure they follow the rules. But the biggest thing we don't want to do is waste vaccine. So, when we have it, when I was with the BI community pharmacy, if we had extra doses, we were like, all right, who do we call? We wanted to make sure we got people in, we didn't waste a single dose. So, so that's a good thing too.
Okay, thanks.
Mm-hmm.
Oh, I think I found the right link, and I'll put it in the chat. And Mike, if you have it as well, you might try to put it there. Winifred, you have a question?
I do. Thank you. This is very helpful and interesting. One of the things I wanted to share, well, two things. One, I wanted to share, I'm with Rotary Club of Bainbridge Island, and they're undertaking a huge project now to help the Bainbridge Island Medical Corps in sort of some of the logistics support. Like, they're thinking at some point there might even be a place where you drive through to get the vaccine. And, remember, I don't know if you were involved, Dr. Matty, with the testing on Bainbridge, but a lot of those people that were involved in that weren't doctors and nurses. They were people that were just doing things like making sure the cars went to the right spot and people filled out the right forms. So there is going to be, I think, something on Bainbridge in a more concerted fashion at some point after the first of the year, because I know they've reached out to all the Rotary Club people to say, are you willing to volunteer to do some of that? I don't know if you know anything about that yet, or if it's being even discussed much, but.
Yeah, no, I think that, again, right now, one of the key things is how are we going to get this administered? And we, fortunately, on Bainbridge have a really beautiful community of people that volunteer and get involved, be it the Medical Reserve Corps, Bainbridge Prepares, the Rotary, the community pharmacy, and as well as the other businesses. So, I think it's going to take all of that to get this done. There are criteria in order to get the vaccines, and there's criteria of who can administer the vaccines. So they're trying to keep that safe. So when you're doing this with the administrative, that was one of the things that slowed us down with the BI community pharmacies. You got to get the insurance card, you got to bill the insurance, you have to, go through all of that stuff. So I think it's going to be a huge help when we get to that.
And I muted you just because I was getting a little feedback, but if you want to unmute and ask a follow-up, Winifred, you certainly can do that.
Well, I just wanted to mention one thing. I had to get my second shingles shot about a month or two ago. And the woman from Bainbridge Island Community Pharmacy, where I go, said, don't get any more vaccines now, because if you want to try and get the COVID vaccine, you don't want to have any other vaccines that you got within 2 or 3 weeks.
Yeah, that is one of the things that they ask about. We had somebody come in who had gotten their second shingles 10 days prior. And, I looked into it. It's not an absolute contraindication. So we went ahead and did it. But, and the only reason is just to give your immune system a chance to really attack this particular vaccine. So, but that is one of the recommendations, is to not have had another vaccine 2 weeks prior. So pretty much any place that administers those vaccines right now should pretty much say, hey, we're not doing it. We're going to hold off because we got the COVID coming.
So, Dr. Matty, I did post a link, and Mike was looking at it, and it looks like maybe.
Sorry, 1 second. It's a little loud here. I just got to shut a window.
Okay, I'm going to mute you while I ask this question. Okay, you can unmute yourself in a minute. Anyway, if you can look at that chart, it doesn't seem to indicate that that if you had a MS or some other similar condition, you might not be eligible. So what you were saying earlier was these are guidelines, and so there might be some further flexibility, I think, right?
Yeah.
Once we get into the administration of the disease, so, or the vaccine. So Mike, I think you should probably just check with your doctor and see if they would feel comfortable doing this. The idea, at least looking at what I'm seeing in the news, is that there are people who are trying to take a VIP treatment and saying, can I pay you to get to the front of the line even though I don't meet the guidelines? And that's what people are cracking down on, right?
Yeah, and I don't think that, I mean, nobody we know is going to do that. But, you know, certainly if you have the vaccine and you've got some to administer and nobody's coming in, there's plenty of room in the recommendations to say, move on to 1B, you know, do that, but just make sure that if one of the people that qualify in 1A come to you, you have it to give them as well. Because it's going to be that kind of gray shifting zone. So I think that that's what we're going to see coming, even, I'm hopeful in the next couple of weeks even. So yeah, so reach out to your providers, let them know that you're ready when, you know, and willing when they have that, or even try to get an appointment, because I suspect most places are going to be moving towards that in another couple of weeks.
So there, just so you know, there's a gap. It's funny. There's a gap in the table from CDC. It says 1B is people over 75, and then it goes into 1C and talks about people 16 to 64 with medical conditions and people that are 65 to 74. So what they did is they just left out people with medical conditions in 1B. They just didn't deal with it, even though, like you said, it should be there. They just forgot. They forgot to put it in.
And I just did a web search, so there may be a better table out there than the one that I put in the link.
Okay.
Well, could it be that they're waiting for feedback from us, the vaccine takers, to see the efficacy on people with pre-existing conditions?
No, I don't think they've done the studies. It's been approved. So there's no delay in who qualifies for it. It's more of how do we just make sure we prioritize those at most risk of the severe COVID. So I have seen, when I have looked at what is recommended as far as the 1A, 1B, and 1C, it does have people with a chronic condition qualifying at a younger age. I'm not sure, I can't pull up right now what it is that you guys are, where you're looking at. You can even go to the Washington State Department of Health, and I'll see here, they have the 1A guidance. I don't know if they have, yeah, they have, the Washington State Department of Health website has a lot of good information too. But you know, I think right now, anybody that wants this vaccine is going to be able to get it. It's a matter of time. So we have to keep being safe, socially distancing, wearing our masks, of course, as you hear. But as soon as we just get through this big administrative hurdle to be able to administer it in a more timely manner is going to be the key. But I suspect that we're going to be in that position pretty quick.
Eleanor, I saw you. Oh, go ahead, Mike.
Will the vaccine immunize me from the Daily News?
That's what we wish. That would sure be nice, wouldn't it?
Even 95%, I'd go for that.
I know, even a small reduction.
Eleanor, did you have a question?
Well, I did, but Dr. Matty actually answered it, because the question was, well, should I be calling my provider, happens to be Pacifica, and making an appointment or getting in line, since I finally found an advantage to being over 75. But another thought occurred.
Yeah, you know, I think we're going to find out.
I got an email.
Oh, go ahead.
Oh, I was going to say, I had an email ad from Safeway this morning, which I thought was a little misleading, because it made it sound, you know, we're going to get the vaccine and we're going to be vaccinating everyone. It didn't give any specifics. And so I said, well, people are going to start lining up at Safeway when they're not eligible yet, which struck me as, you know, a little commercial, shall we say.
Well, and maybe something the pharmacists hope would not happen, but they'll get to deal with it. Yeah, but it sounds like you can get your name on Pacifica's list.
Yeah, I mean, we have everybody's name, so we're going to send out. The hard part is if we only get a certain number, you know, how do we, and we'll give everybody an appointment, but we'll use up what we have. And so it's going to be hard to figure out how to do the prioritization list, you know. So I think certainly 75 and older, and then people with the comorbidities below that. And, you know, if you get 300 doses, you can use that up really pretty quick. But then we should be able to get another shipment the next week. So once you're on that path, we suspect it's going to be very easy to keep it coming. And the way our clinic is designed is such that we should be able to provide that. Now, if you look at, say, Bainbridge Island Community Pharmacy, they had the MRC. We were there to help them administer it, but then they got it, you know, all the rest of their work they have to do. So maybe in every other week kind of time frame for this, you know, giving out a ton of doses might be what makes the most sense for them. But I don't know that. They might be doing it as much as they can every day as well. I'm sure they are to some degree, and administering it. It's just with these restrictions on the 1A versus 1B, that's kind of the other funny part. You know, you want to make sure that you don't want to waste it. So as long as people start feeling more comfortable spreading out from those strict criteria, and I think once people are like, boy, we've really done a good job, there's not much, you know, many more people, first responders, there's nobody else coming in, healthcare providers in the community, you know, then we'll feel a lot more comfortable kind of going in that gray zone.
Also, it seems to me I heard some discussion way back before the vaccines were approved that one might be better for older people than the other. Is that a true fact, or, you know, should one wait for the one that's stamped old people?
I know, right? I wish, you know, right now there isn't a big enough difference to recommend one over another, to be honest. I think the effectiveness of 95% of both the Moderna and the Pfizer, that certainly is better than 74% that we're seeing with the AstraZeneca. But that one, you know, that's still a really good number. But when you have these other ones, it's hard to say, okay, I'll take the 74%. And, you know, they look at all those stratifying of people by ages and risk factors with using all of these different vaccines. And there has been some evidence that some work better for seniors than other ones. But after the second dose, the key thing is the 2-dose series. After the second dose, they're both equally effective. So the key thing is making sure you get the second dose, because it's really after the first dose that they have a different effectiveness between the Moderna and the Pfizer.
Dr. Marie, I have a question about people that are in rehab centers or care facilities. Have they been, has the vaccine been administered to them? Because that seems to be a high rate of infection area. Do you know how that's going?
Yeah, that, you know, last I had been in touch was on the 26th of December, so just a few days ago. And at that point, we were having staff from some of those facilities come in so they could get administered sooner than waiting. But they have this agreement, particularly with Walgreens on the island. And so they're waiting for the final details, but it should be happening, maybe even happening this week. I just don't know because I haven't heard since the 26th. But it's there, it's available for them, but they want to be able to go in with their facility rules and administer it to everybody as soon as it becomes available. So I know that they're working on it for sure.
So imminent, but maybe not maybe not having happened right now on Bainbridge.
Yeah, because I said, well, can I just take them to our patients that live in, you know, assisted living? And they're like, nope, we don't want you to do that. You know, they've got a system set up at those different facilities. And so no, but we did say any of the caregivers or providers or nursing staffs, you know, the CNAs, any of those people could come in and get it.
Lynn?
I have a question.
Yeah.
If you get one vaccine like the Pfizer, you should make sure that your second vaccine is still a Pfizer and not a Moderna, correct?
That is currently what's recommended, even though they're using the same mRNA, but the what it's supplied in, the lipid vehicle that it's used to administer that mRNA, that's what's different between those two different vaccines. And because it's something in there that when you read about people having allergic reactions, so once you've had one, it's nice if you stick with that same one because you know you tolerate it, you had it. So right now the recommendation, stick with the same vaccine, which is wherever you get your vaccine. So for example, I had Pfizer because I got it from St. Michael's. When I go back in there, they're going to have the Pfizer again because they have the capability to keep it frozen at the strict criteria that it requires. Whereas Bainbridge Island Community Pharmacy will probably continue to get Moderna at this time.
So you don't get your first vaccine at your doctor's office and your second vaccine at the pharmacy.
Yeah, I mean, it's best if you verify which one they gave you so that you make sure you get the same one. It doesn't matter where, because it all gets reported into the Washington State vaccine database. So we're keeping track of that. You also get a vaccine card. I could show you mine, which has the CDC and it has your lot number, which I think is going to be an important thing to have in the future. But yeah, right now the recommendation is get the same type of vaccine, not necessarily where you get it, but getting it at the same place. You're most likely going to continue to have access to that same vaccine type.
You mentioned a little bit about reactions, side effects, and allergic reactions. Obviously, those numbers on a national basis are pretty low, or a global basis. But are you seeing any of that here with anybody that you've been working with?
Yeah, we haven't had any severe allergic reactions at all. People tolerate it really well. Most people feel like they don't even feel it, which is interesting. Just what it is made up is just not really acidic, doesn't really burn, and the way that it's administered, it's really easily administered. You do get a sore arm for sure. People that have had the Shingrix say it's not as bad as the Shingrix reaction, but that's only after the first dose. I'm suspicious the second dose is going to be more significant because then your immune system's prepped and ready to go. Muscle aches, fatigue, headaches. I have heard that usually starting the day after the vaccine and only lasting 1 to 2 days. So it's really pretty well tolerated. But when you have the soreness in your arm, that's not the vaccine, it's your immune system recognizing it. So it can make you feel good knowing that it's working, because what we need, especially for seniors who don't have as robust of an immune system as, say, a young child, we want to make sure the immune system's responding. So when you get that sore arm, think, oh, good, my immune system's taking care of it and doing what it's supposed to do.
Good to know. Good to know. And can you give us a little advice about the PPE, the wearing of masks and distancing and all the things that we're doing to try to keep each other safe? How do we respond to that after we've gone through the vaccine?
Well, what's still yet to be determined, and hearing different news, you can hear a lot of different information, but right now what we don't know is, does the vaccine completely prevent disease or just severe illness? And so we know it prevents severe illness, and that's ultimately what we want, for the individual. But for a public health standpoint, we want to prevent disease transmission. So that we're going to be able to determine in the coming months as they check the antibodies to people that have been vaccinated, to check for different antibodies to see if they actually had an infection afterwards. So that is still not completely answered, even though you might hear people saying different things. So at this point, what's recommended is still wear your mask, still socially distance, still do everything you can that we're all doing in an effort to prevent spreading it if you were to have it. But, it's still a low likelihood of transmitting it, but that's what we need to be careful of still until we have more data for sure.
Okay, anybody have any questions about that? Mike has another question about whether the vaccines might be effective against new strains. I know we've heard about a particularly virulent strain that's been spreading lately. Latest report in Colorado.
Yeah. Well,
any
I'll tell
comment
you,
on that?
Yeah, the beautiful thing is the way that these two vaccines were created was for the spike protein. That's what that mRNA is coding for. It's the RNA that codes for the spike protein that's on the outside that allows it to attach to cells. So that's why it's so effective. And we actually expect it to help us prevent all sorts of coronavirus, because all coronavirus have that spike. So we're going to see with this vaccine not only an improvement against the SARS-CoV-2, but probably your run-of-the-mill coronaviruses that cause upper respiratory infections that we have all around, endemic, that we have had forever. As far as the new strain, it doesn't look like there is any reason. There's no scientific explanation for it to be less effective unless the mutation changed the spike protein so significantly that it bonded to our cells so differently. But right now it doesn't look like it'll be that significant. So the good news is it looks like it'll be just as effective. And important to get going as soon as we can because of that.
Yeah. So the common cold will be less then?
Yeah. I mean, the common cold is caused by a whole variety of viruses. there's tons of them, rhinovirus, RSV, but there are some coronaviruses that do cause the common cold. So yeah, so those ones. There's also some interesting ideas behind, like this was one suggestion, was the measles, mumps, rubella vaccine. Mumps has a spike protein as well, different than the coronavirus. So some people said, well, go get an MMR vaccine now because it should help, because they've also done studies that show people that have had higher titers. I'm going to segue, but I wouldn't recommend it if you see this, because of the whole idea that you don't, if there's a little bit of, protection that comes from that, we don't want to, stress your immune system doing that while we're waiting. Because I think the COVID's going to be around in a couple of weeks. That would be my recommendation, because I saw Kitsap Sun article recommending potentially seniors go get an MMR booster, but I don't think that that's really ideal at this point.
And you did talk a little bit at the beginning about how this is a novel technology, a way to develop vaccines that has been percolating in the research area for a long time, but apparently was difficult to figure out how to actually make it work. And now we actually are going to probably see a breakthrough to some degree because of this learning.
Oh, yeah. Huge. I mean, this is going to be the future of cancer treatments, of all kinds of different therapies to incorporate and help our immune system fight different DNA abnormalities. So yeah, I think this is going to be a game changer for all kinds of the future in medicine.
Can you say a little bit more about that?
I mean, I think there's so much research going on in this direction. They've been talking about using viral particles to put DNA into all kinds of abnormal cells to help repair and fix what's gone wrong with them. So that's the idea behind it. I think that now that we have a vehicle, we have an understanding of how to do it. It's entered our, the reality of the way that we do medicine. But I think it's still, this is all experimental stuff. But there's people that are super passionate. So I think we're going to start seeing things like this coming out in the next 5 to 10 years.
Right. And there's obviously now a lot more funding that's possible now that we've seen the success that they've had with this technology.
Oh, yeah. Yeah. This is going to take off. And now we've seen it. We've seen how it works. We've seen it be safe. We've seen it be effective. And so I think we're going to be able to use this technology to create vaccines, potentially for all kinds of diseases, as well as targeting treatments for abnormalities in DNA that leads to things like cancer in particular.
Winifred, did you have a question? I saw you had raised your hand, but.
Well, I just wanted to mention, a year ago, I was at a TED Talk in Seattle. It was November of 2019. And there was a professor there from University of Washington who was talking about this messenger RNA in its use for cancer treatment. Yeah. And, at the time, it just didn't really seem like it was even like anything that was going to happen in the realm of my lifetime. But it actually, this is like unbelievable that this is happening now, because like you said, Dr. Matty, he was using it. He was at the Fred Hutch Cancer Center, and he said it was going to be like the magic bullet they needed for cancer treatment, which is amazing.
Yeah, super duper exciting. Super exciting.
This is so
super exciting. We got super duper. I love that. Rita, Rita, you have a question?
Yeah, I do. I was wondering how CRISPR, where they fix things with CRISPR, that how they can go in and change DNA stuff for things. Is that going to work is that kind of on the same kind of deal as this COVID vaccine, or is that just totally different?
I think I'm not sure exactly what you're talking to, what you're referring to exactly.
Oh, they have this, there's a technology called CRISPR. And I've seen several articles on it. And then there was an article about a gal a black gal that they put this in, and because she had sickle cell so bad, that it changed.
That's all the gene therapy, all the DNA. So that is exactly what this is the way that you change DNA.
Right.
Is by using a virus vehicle to incorporate new DNA for all kinds of diseases. Yeah.
Okay.
Probably at so many levels. I mean, it's unimaginable. You can't even imagine the way that this can be used.
Right.
You know, cancer for sure, but all kinds of different targeted therapy. Yeah.
Okay. I was just wondering if that was kind of the same deal.
Yeah.
Okay. Thank you.
Yeah.
I really want to thank you for your time today, and we learned a lot. We're really grateful for you spending a few minutes with us today and answering some of our questions. And the senior center is willing to help in any kind of way that we can to make this delivery work. And obviously we will spread any information that we have through our website or the emails that we put out on Monday morning. So
Absolutely. And as soon as I know more or Andrea Chimey knows more, we will be sure to let you guys know too.